I'm James Sutton. This is Road to Recovery. I'm a person in long-term recovery. And my special guest today is Stephen Murray. Welcome.
Welcome. Thank you. Nice to be here.
So, Stephen, can you say your title? Because I don't want to mess it up, right?
I'm the Division Chief of Medical and Behavioral Health Services for Montgomery County Department of Corrections and Rehabilitation.
And that's a mouthful. and his work, you know, is even more enormous than his title, right? He's responsible for so much. But first of all, I just want to get into, I read your bio, and it, you know, it was so interesting. You come from a big family, and, you know, can you tell us a little about your background?
So, so I wouldn't be me if I didn't give a shout out to the great state of Alabama, Roll Tide.
Okay.
I'm a University of Alabama graduate. And I have 8 siblings. It's 5 girls and 4 boys. I'm the youngest boy. I have 3 younger sisters that are really, when I think about, I guess, you know, sometimes you have to find things that motivate you. My 3 younger sisters motivate me every day to get up and just go for it. They are what I like to call superstars. Super women is what I refer to them as. Our dad died in 2000, and my oldest sister, well, the oldest of the 3 was, I was 14, she was 12, one was 8, and the other one was 6. So they pretty much grew up without our dad, and I feel like my dad was an amazing guy. I know he was, and so as I always tell them, they had every opportunity to be a lot of things, but they chose to be successful. So those are my girls. All
right, yeah, it's great to have family support. I'm sure that has a lot to do with your success. So I also read that you're in, you know, I really like it when a person that works in the jail system is also a social worker, right? And you have a social worker background, which, you know, I really love, you know, because we also, you know, our division chief has a social work background. You know, I think that really helps when you have, you know, the justice involved and then the social work, which deals with motivation, working together. So can you tell us a little bit about medical social work?
So it's interesting. I haphazardly ended up in social work. I was actually in school for nursing, and I was it was my sophomore year at Jacksonville State University, and I was in my English class. And you know how most professors make you go, everybody introduce themselves, tell what a long-term goal is of theirs, and then they move on to the next person. And so I was in that English class, and my professor asked us to introduce ourselves, tell us a long-term goal, and I told, of course, Stephen Murphy, and I was interested in, what I didn't know at the time was it's actually called reentry. But what I said was I was interested in helping people who were recently released from prison to kind of assimilate back into the community, making sure that they were connected to resources to be able to do that, as well as to work with the homeless population, helping them to be rehoused. And she said, you should look into social work. And I had never heard of social work. And the little experience I had with it was that they were what they call baby snatchers, right? When you think about the foster care system, child welfare, people that come in the home and remove people from their home. And that was my experience, or my extent, my knowledge related to social work. And so I went the next day, after introducing myself, she said, hey, you should look into social work. So I went the next day to our social work department and looked at how broad of a field it was, and I literally changed my major the next day.
Wow.
And so I ended up in social work. And the funny thing is, the last job I said I would take was the first job I took out of school. So I said I would never work for DHR. In Alabama, it's called the Department of Human Resources. But I said I would never work for DHR, and that was the first job that I took out of school. And I guess I would say it's one of the most challenging but rewarding jobs that I've had so far. Simply because I had the opportunity to see individuals who may be struggling of some sort, and our goal is to, at the time when I was working as a foster care social worker, was to get children back into the home with their parents.
Wow.
And so with that, it was a 24/7 job. It never ended.
Yeah.
But because, as I tell people, when my dad died, it was that was a experience for me, being 14 years old, and I had a lot of people to stand in the gap for me. So I kind of took it on as my responsibility to stand in the gap for others.
Right. That's great. You know, because I often wonder why people do this work. 'Cause sometimes, you know, it's not like for the money. You know, especially initially.
No.
You know, entry level is definitely not for the money, right? You know, IT or doctor or lawyer, you know, you're not really, you're just, you know, trying to get paid, right? Pay off those school bills, right?
Yes,
those school loans.
Student loans,
Student loans, right? But in social work, you know, and nursing too, it's a lot of passion, you know, and it can be for, you know, like you said, because of your family, you know, sounds like you had a very nurturing family, you know, your sisters and your father and your mother sound like they were great, you know, mentors, you know, molding you into being the kind of character that you are, you know. So that's really important. And so many people in our community don't have that mentorship, don't have a strong family. Our family structure is really weak, really, in the Black community, you know. Because of incarceration, you know, because of drug use, you know, and untreated mental health, you know, and you hit it on the head. Like the homeless population is really like continuing to rise, you know, across America. So it's obvious that, you know, those of us that care need to, you know, put some service in that area, right? So I'm glad that we have you on board. Now, also. You know, you have such a responsibility, you know, sounds like, you know, you have a foundation in nursing.
Well, so I ended up changing my major, so I didn't complete that program. I actually went into social work and finished it. But my first job outside of, while I was actually in college, I was a nursing assistant at a local hospital in Alabama. So I guess I've always been in the helping profession, and that's just something I enjoy doing, seeing people excel. Okay.
Have you? I think I read that you did some nonprofit work too. So you do this. When you leave work. Do you still do these? Do you still do it?
So I haven't found a place in the DMV or Montgomery County area to kind of plug into. But when I was definitely at home in Birmingham, I was working with this nonprofit called Ceasefire that worked with underserved youth in the community in Birmingham, the Housing Authority in Birmingham, Alabama, and the goal was to reduce gun violence.
Yeah.
And so I was a site coordinator for them, and we met twice a week, weekly, and I had a time. Those were my kids, right?
Oh, what ages?
Ages from like 5 all the way up to 17.
Oh, wow, that's the right time to start.
17, 18, somewhere in there. Yeah.
They need mentors, you know.
Yeah, so we had individuals coming in from the community, physicians, police officers, engineers, social workers, nurses, coming in and exposing the children to different opportunities. Because, you know, sometimes if you don't see people that look like you, or you don't see people that are being productive, then you don't know that it's a possibility.
True.
And so our goal was to really get individuals exposed to, hey, there's somebody that look like me in this particular role doing these things.
Right.
So that was always a goal. And we had the opportunity during my time with that program. We worked with a little over 200 individuals. And interestingly enough, that we had parents that were participating in the program as well.
That's
actually
important.
One of the parents who had started with us, she ended up doing the process. We kind of worked on some interview, resume building skills.
Oh, good.
She ended up getting a job and kind of working herself out of the program which was good, but our kids stayed on, and it was rewarding. Like, I don't have any other words to describe.
Right. I know I'm doing the same thing, or similar in DC, violence interruption, and I found that a lot of times the kids, even if you work with the kids, if the parents are still carrying on unhealthy behaviors, it's very difficult to send them back to an unhealthy house where after you show them some coping skills and some opportunities, and then the parents don't reinforce it, and let them, the parents may give them negative self-talk,
Right, and so we think about that's pretty much systems theory, right? If if one thing is off in the system, everything is off, right?
Okay.
And so when we look at that, it's if we take an individual kind of out of their environment and we do the work with the individual, and then we put them back in the environment that was behaving in this certain way, if the environment doesn't heal, then what can you expect of the individual?
Right.
It's highly likely that they're going to go back to that same behavior that you've done all the work to correct. And so it's kind of, engaging people in the change process, not only just the child or adolescent, but looking at the system as a whole. Okay, what does the family look like? How do we move beyond the this particular issue that we're working towards to then get everybody to where we feel like they need to be?
Right.
So,
right. I got a friend who she did like 18 years straight. She's from DC, right? And now she has her own organization in DC helping women, right?
Oh, cool.
And the quote, I like your quote at the bottom of your emails, but her quote at the bottom says, "It's easier to help children than to later help broken men."
Absolutely, that's true.
And that's so important, because we see a lot of broken men on our job.
You're right.
But a lot of them started with, broken homes.
Well, that's one of the things, right? It's easier to teach a thing than it is to reteach a thing, right? Because if you're reteaching, then you're having to break down all of these barriers, all of these thought processes that have kind of become ingrained in our foundation. And you kind of have to, I guess what I like to say is you have to, if I can catch you before you get started, then I may be able to go a little further in the process as far as making sure that you're operating at your full potential. Right.
So that's what we try to do at Tree of Hope. We may have to, so we have the perfect nonprofit for you. And you talked to LaTanya today, right?
Yeah, actually, so she saved the day.
She saved the day. She did, as always, right? So you're gonna have to come to our office and visit, because we have a community center now, a recovery community center, which, it's happening all across the country where people in recovery are starting their own community centers to advocate for people in recovery, right? And so we have a community center now right across from the court, right? And we provide service. We have computers. We have like youth coming in. We have a youth day. We have peer specialists that are 18 and 19 that will go into the schools and help those students who have, substance use disorders, right?
Oh, cool.
And we do have a physician assistant that comes in too. That's right. So if a person is like, disoriented and they're disconnected with their primary, they don't have any meds, they can come to our office and make an appointment with the physician assistant, and we can do a bridge until they actually can connect with a primary. Right.
Good. So it's kind of at the different points of contact. You catch them while you have them, and then until you can get them transitioned to where they need to be.
Right. Because we find a lot of people who, when they're using, they don't make appointments. They don't. Their insurance expires. Homelessness, not bathed. Hygiene slips, all those things. So. Connection to medical is also important. I see it's out. We're out of time. What did I tell you? So we're going to take a commercial break right now, and we'll be right back with Stephen Murphy.
I'm an ex-drug dealer.
And I'll be your sub today. Can you see anything different as a pill?
No.
You don't know?
Fentanyl is being mixed into everything now. There's only one thing that will save somebody's life. That is naloxone nasal spray.
Fentanyl, it's cheap, it's potent, and it's profitable.
Why would drug dealers put a lethal dose of fentanyl in drugs if they know it's so harmful?
Really just all about the money.
I just didn't realize that one pill could change your whole life.
More kids should know.
Hi, I'm James Sutton. We're back with Road to Recovery. My guest today is Stephen Murphy. And we were just talking about some of the service work that we do, me in D.C. and Montgomery County and you in Alabama, and soon to be with Tree of Hope.
Hey, there you go. Plug me in is what I always tell people. Tell me what to do.
That's right. We need you. You're a resource, right? You're a valuable resource. So now let's get into your job as Chief Division Officer for how is it medical?
I was Division Chief for Medical and Behavioral Health for Montgomery County.
Okay, all right. So what does that entail?
So really it looks at, when we look at the operations, right, we're looking at what services we have in place, almost like program evaluation. What we have in place, are we meeting our goals? What can we do to, if there are changes that need to be made, meaning are we assessing our programs to make sure that we're continuously working at our goals and looking at ways to improve what we're doing, build on what's working and make some adjustments to those things that aren't, based on the resources that we have available.
And when did you start?
I started in November of 2022.
Okay, so it was a little bit
towards the end of COVID, maybe 6 months before COVID, before the federal government. I think it ended in May of 2023. So maybe about 6 months before COVID ended per se.
So you actually took the job while COVID was in the jail, right?
I moved from Georgia.
You moved from Georgia?
I did. I came here from Georgia.
So how was that? Because, you know, on cruise, I'm thinking that on cruise ships and on jails, because everybody's so confined, it's just like a petri dish for disaster. You know what I mean? So was that a challenge or?
So fortunately, the CDC released guidance related to congregant settings, and so we followed that. And you know, anytime when we look at like increase in COVID, we do use we do make sure that we're following the enhanced guidelines to ensure that we reduce like the spread of COVID. But in the congregant setting, especially in a correctional setting, right, you don't determine who's coming, right, and you don't determine how long they stay. Right. So the police will kind of make the determination of who you're going to get. Exactly. And the courts decide how long they're going to be with you. And so what we do is we make sure that to the best of our ability and with the resources that we have, we make sure that we're trying to reduce the spread, and then we treat individuals that test positive, and we're going to be treating the symptoms. Okay. And so that transition has been good. We've had no COVID-related deaths. Montgomery County Department of Corrections, since I've been there, or even prior to our last administration, did a good job of ensuring that. And so we do the best we can.
Wow, that's fantastic, because other places have reported deaths
we
across
had
the country.
No COVID-related deaths.
In prisons across the country, you know, some inmates reported to me that it was bodies in the cell with them, you know. Unfortunately, in some places, you know, did not here, right?
Yeah. So masks are still optional, as we know with flu and with COVID and RSV has been an uptick. And so what we're doing is we continue to screen and we continue to treat as necessary. Okay.
So what are your standard, when a person gets locked up, do you just give everybody a physical, or you test for COVID, or?
So when individuals come into custody, within 24 hours, they're going to be assessed by a registered nurse. Anyone that has any type of symptoms or any type of medical conditions that are outside of the nurse's scope to treat, then we're going to refer them to the physician. Within 14 days of being incarcerated, individuals must have a physical as well as a TB screening to make sure that we've assessed kind of the medical need, made appropriate referrals, as well as ensuring they're on the right medications and things of that nature. And then as well as the TB, make sure that they're not infectious and spreading it around the jail, because of course those congregate settings, right? Everybody's not necessarily elbow to elbow, but they're in close proximity. And so we want to make sure that we don't have any infectious illnesses spreading across the facility. Right.
And what about mental health? Because in your job, you deal with addiction, somatic, and mental health, right? And you do well working with the different partners that you have. So definitely with the mental health population, a lot of times they're there because they're not on their meds, right?
Right. So we partner with Montgomery County Health and Human Services for individuals at our Montgomery County Detention Center. We have a clinical assessment and transition services team that will meet with them. If we have the ability to divert them to different treatment that we feel like, sometimes a correctional setting becomes the catch-all, as we know, right? And so sometimes the correctional setting may not be the most appropriate setting for an individual. So if we have the ability, based on charges and based on the legal ramifications, if we have the ability to divert them from the correctional setting, then we'll try that. And that's handled by our clinical assessments and transition services team through HHS. Now, once individuals transition up to Montgomery County Correctional Facility in Clarksburg, then we have a DOCR mental health team that comes in and provide the mental health services, and they fall directly under me. So I work with the CATS team. I work with them while they're within DOCR, but our DOCR team falls directly under me. So we offer counseling. We also offer medication management. So individuals will see one of two nurse practitioners during their time there to continue their medication management. Sometimes people come in on medications that we continue, and other times during the assessment process, we learn that individual may need medications and they will be started here.
That's good, because many of them haven't been on meds for a while. And that could be the reason why they got the charge in the first place.
That's why they're hanging out with us, right?
That's the reason why they're there, because if they're on their meds, they'll be stable and they won't be doing whatever's inappropriate, right? So, I definitely have seen that, and I've seen inmates improve once they're on their meds and can be released, healthy. Into the community. Sometimes getting locked up can be a good thing. Absolutely. That's why as I tell everybody, especially individuals that I know are leaving, is that we like you, we're glad to take care of you, but we don't want to see you again. And it's because our goal as far as rehabilitation is to be able to provide individuals with enough support that when they're out in the community and they have the option to make choice A or choice B, and if we know it's A is the right choice and B is the wrong choice, we want them to make choice A. And so I think Montgomery County does an amazing job when it comes to resources and actually investing in the individuals, the population that we serve. That, as I tell my boss all the time, if people can't get it right after they've been in Montgomery County, I don't know if there's a desire to get it right, because we invest a lot of resources and into individuals. There's a lot of programs at our jail that I don't know that are present in other places. My brother, my older brother, did 20 years in state prison in Alabama. I would say he was a success story, because he got out, married, son, working, using a degree that he obtained within the justice system through the community college that partnered with that particular prison. And so for me, this job is kind of like a full circle moment for me, because as I talked about when I read how I even wanted to end up working in corrections, and then actually having the opportunity to give back
to other family members that which my own family member has received. So
Right.
it's a great opportunity, and I don't take it lightly, and my staff know.
Yeah.
We are here to provide a service, and I believe in customer service. Don't have to like the people, don't have to care about what got them here, but while they're here, we're gonna take care of them.
Right, and I see that in your work. You know, not only do I see your work ethic in terms of helping the population that we serve, but also with your coworkers. You know, and that's pleasant. I mean, that's really good. You know, to have an addition. You know, and not just the coworker, but I mean management too. Mm-hmm. You know, you kind of make people work together rather than politically. You know, people take their little corners and, you know, battle over crumbs, right? You know, you do a good job of making us, you know, unified, you know.
But what my philosophy is, they're not going to say Steven sucks or Steven's bad, right? They're not going to say James is terrible. They're going to say Montgomery County DOCR is trash.
Oh, okay.
And I'm from Alabama, and as you roll tide, if you know anything about our football team, we are some winners, right?
Yeah,
and
sometimes.
So hold on now, watch out. But I only know how to win. Like for me, it's one of those things where I take pride in what I do. I could have worked with numbers, been an accountant, things, but I have the opportunity to work with people. And like it or not, when you work with people, then what you do is sometimes can make a difference on whether they improve by seeking services or if they don't. Because a lot of times we have that one opportunity to touch a person. And if we squander it, then this individual could not get the help they need, have a bad day, and end up in the community doing something that eventually will affect you. Right. So for me, I have to look at it as I have to do I'm doing what's best for you, because my hope is it will affect others in a positive light. But you don't want to squander the opportunity to take care of people. And I learned that from my parents. I got to get them that. Like, yeah, treat people right.
You were raised properly, because, you know, most of the people that we see have a mistrust of caregivers. Mm-hmm. So we already are working, you know, with a mindset that doesn't trust us. Mm-hmm. You know, when we start the interview process that you talked about at MCDC, the story may be, we may get 7 different stories by the time they get to us.
That's right, yeah.
At MCCF, they've answered the same question 17 different ways. That's because right. They don't trust us. Mm-hmm. So when they have a person who actually genuinely cares about them and gives them genuine concern, you know, it can change their whole outlook toward caregivers. Mm-hmm. Not just, you know, when they leave you, the next person that, you know, they sit in front of may have a better session.
Oh yeah, absolutely. and that when we talk about rapport, that's why that's so important. And that's why I take it seriously. Like I really do. I have had the opportunity to work in mental health the past, I want to say 16 years, and I stumbled upon it haphazardly, which is funny. But I cannot see myself doing anything else. I've had a lot of fun in mental health, from both with coworkers and actual individuals, and it's important. Like I said, the outcome is important to me. And I work hard and I have fun while I'm doing it.
Yeah, definitely. And I enjoy working with you. We're about at the end, and I told you we can do another session, right? It's gonna go fast, right? So in closing, is there anything that we didn't talk about that you want to mention in closing? We didn't really talk about addictions, but you do. You are responsible for the detox process. Mm-hmm. You sit in on the MAT process, mm-hmm. because we do provide medication-assisted therapy, mm-hmm. at MCCF. Some places don't, and you've been a part of that. Mm-hmm. What can I say? You're covering all the bases and doing a great job, right? Doing a great job. So I'm so glad you were able to come in today. I'm glad you made it. Anything you want to say in closing? We got a few
well,
seconds.
just say, as I tell everybody, while you're here, we're going to take care of you, but we don't want to see you again. Unfortunately, our setting is one that people don't voluntarily come to.
Right.
But while we're there, while you're with us, we're gonna take good care of you.
And that's for real. That's for real.
Yeah, I believe in it.
So I'm James Sutton. This is Road to Recovery. My special guest today was Stephen Murphy, and I'll see you on the road to recovery.